This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, well, good morning, everybody. So, interesting to look at studies. Sometimes studies can, give us something new to try or change the way we practice, and sometimes they just kind of affirm or kind of make us feel good and validate about things that we already do here that might be a little cutting edge or progressive. So for a while, we've been doing antibiotics as pushes instead of long infusions. Rocephin's probably the most common one that we use. Makes good sense, seems to work very well. I think it, makes things a lot more efficient, but it's not necessarily totally standard and accepted everywhere. So there was a study recently, and it was one of these interesting studies that came about because of a supply shortage. So there was a shortage of normal saline bags that were usually used for infusions of antibiotics. So a hospital in Chicago decided to study the transition to push dose or push antibiotics when they didn't have the infusion, so they kind of had to do it. And they looked at about 800 patients, and they looked at it, retrospectively, 800 patients who got Rocephin, and then they reviewed the charts pretty thoroughly to see if there were any problems from it. And, after looking at them and having multiple people kind of confirm them, they had one possible problem at 800 people, and it was an episode of vomiting. So not anything really too serious, no bad reactions, no hypotension. So, I think from what we do here, it makes good sense. I don't know of any problems that we've had from doing, push antibiotics instead of a slow infusion, and it definitely is more efficient. So kind of a nice study confirming what we already do here, something I think is a really nice practice. Any questions or comments? Thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.